Hey all, I'm Dr. Abdul Tawfiq, assistant professor. Today we are going to learn about a condition called poliomyelitis, commonly known as polio. Even though the vaccine has been controlled this type of disease in many countries, it is still important for us to, especially as a healthcare professional, to understand completely. Shall we start? What is poliomyelitis? Poliomyelitis is a highly contagious viral disease, mainly affects children under the age of 5. It is caused by poliovirus which attack the nervous system, can lead to muscle weakness, paralysis or even death. Most infected individuals shows no symptoms but can still spread the virus. Um, Caused by poliomyelitis from the eventavirus group belongs to the virus enters through the mouth and multiplies it in the intestine. It can invade the central nervous system, leading to paralysis. Um, Types of poliomyelitis: appropriate polio, non-paralytic polio, paralytic polio. What is appropriate polio? It causes minor illness. Mild symptoms may be causes pure fever, sore throat, headache, nausea, and vomiting. No nervous system has been involved in this types of polios. Non-paraphyletic polios means affected central nervous system but does not cause any paralysis. Symptoms like neck pain, back stiffness, muscle tenderness, fatigue can be occurred. What is paralytic polio? Severe form of polio, rare but serious in the conditions. Virus invaded in the brain and spinal cord can lead to spinal polio, affects the legs. Bulbar polio affects the breathing and swallowing. Bulbospinal polio, a combination of both legs and breathing, swallowing, etc. How do they transmission? Spreads primarily way of fecal oral to route, commonly in area with poor hygiene and sanitizations. How they transmissions? Touching their hands or object contaminated with stool, eating or drinking in with contaminated food or water, rarely spreads through cough or sneeze droplets, etc. Prevention: how we can prevent? A polio is a vaccine preventable disease. Immunization is the most effective method for prevention. Um, Focusing is on stopping both infection and transmission. Two types of vaccines: OPV, oral polio vaccines, live present transmission, prevents transmissions. IVP, inactive polio vaccines, killed virus, provides stronger internal protections. What are the managements? Poliomyelitis, um, as we saw before, the poliomyelitis has different ways of approach, and there are different types of polio. Uh, Now, in this part, we can study the management clearly and detailed report. How we can protect the polio. Early diagnosis and supportive care are essential. Focus on rehabilitation to prevent complications. Um, Special attention to the post polio reducible paralysis. Post polio reducible paralysis occurs after the recovery from the acute stage of polio, leads to persist muscle weakness and joint deformities, requires long term of management and rehabilitations. Mm, uh, what are the rehabilitation steps or treatment residuals? Non-operative management, physiotherapy to maintain joint mobility, strengthening exercise for weak muscles, and use the orthotic device like braces or capillaries. Gait training and mobility aids, patient education for home care and energy conservations. Principles of muscle transfer. Restore the functions or paralyzed region. Use the healthy muscle to replace the non-functional ones. Improve daily activities performance and quality of life. Requires carefully planning and most operative rehabilitation. Factors influencing success of muscle transfer: strength and condition for the donor muscle, range of motion, flexibility of the joint, good blood supply, and nerve functions. Patient motivations and adherence to the physiotherapy may be included. The procedure, mm, there are two procedures. One is Surat's release, and Yon's release. What is Surat release? Common muscle or tendon transfers, and so on this, another one is orthopedic surgery to correct the deformities. Next, hope you understand the poliomyelitis. Early prevention and proper rehabilitation are the key to managing the poliomyelitis. As a future healthcare provider, your role is vital in prevention and care of these type of patients. Once again, thank you all. Hope you all understand these topics. Poliomyelitis.